We are officially in the Medicare Part D AEP, so let's discuss some big changes for 2024. Hi there, as always, a reminder that we are licensed health insurance brokers, so if you have any questions whatsoever about your Medicare coverage, you can reach us at the number on the screen or at the comments below, and there is of course no charge for our services. Now we release these videos on a weekly basis, so please make sure to subscribe to stay up to date, and of course click that like button so we can get this information out there. So today we're going to be talking about the Part D AEP and the changes for 2024. Make sure to stay tuned to the end of the video because we'll be discussing not only the changes, but we're going to also take a look at some of those 2024 plans. Now, unless you're enrolled in a Medicare Advantage plan that offers prescription drug coverage, you'll likely need some type of prescription drug plan. And those are, of course, Part D plans, which are strictly prescription drug plans. Because remember, Original Medicare does not offer prescription drug coverage except very, very limited exceptions. This list is available on Medicare.gov, and these are the prescription drugs covered under Part B. And you'll see here, usually Part B drugs you wouldn't typically give yourself. So the pills that you take every day to cover some of those more basic ailments, things like high blood pressure or cholesterol or thyroid issues, or even antibiotics if you have a sinus infection, wouldn't be covered under Part B. However, these types of medications would be. The Alzheimer's drug, drugs used with durable medical equipment, some antigens, injectable osteoporosis drugs. So you can see these are things that are mostly administered by a doctor, blood clotting factors, injectable and infused drugs, oral end-stage renal disease drugs, that's very important. If you scroll down, you see that shots and vaccinations, transplants and immunosuppressive drugs, oral cancer drugs, oral anti-nausea drugs, so that has to do with chemotherapy and cancer-related drugs. Because these are falling under Part B, basically you'd be responsible for 20% of the Medicare-approved amount unless you have a Medicare supplement plan that covers your Part B coinsurance. Now, Part D plans are offered by private carriers, but they are federally regulated. Every year, the government sets the financial limits for the different stages of Part D. Specifically, we're talking about the deductible, the initial coverage period, the coverage gap moving into catastrophic coverage. So let's talk about those numbers in 2024. So in 2024, the maximum deductible that any plan can charge is $545. That's up $40 from $505 in 2023. Again, this is the maximum deductible. Plans can choose to offer lower deductibles or even no deductible to entice beneficiaries. However, you'll usually notice that plans with lower deductibles have higher monthly premiums. That's not always the case, but there is usually an inverse relationship there. Before you've met your deductible, you'll have to pay for your prescription out of pocket. Although almost always those lower tier medications will be covered prior to meeting the deductible. Once you've met your deductible, you'll move into the initial coverage phase. At this point, you'll be responsible for a copay or coinsurance dependent upon the tier of the medication. Medicare will keep track of your spending as you approach the coverage gap. And in 2024, that limit is $5,020, which is up from $4,660 in 2023. Once you've entered the coverage gap, sometimes referred to as the donut hole, you will notice that your prescription drug costs will increase. If you keep spending and you reach $8,000, at that point in 2024, you will enter into catastrophic coverage and your costs will dramatically decrease. This is up from $7,400 in 2023. Now, some other important changes. You probably already know that insulin is now capped at $35 for a 30-day supply. However, now also preventative vaccines such as the shingles vaccine will be covered at no cost prior to meeting the deductible. Okay, now let's take a look at the plans. Medicare.gov will first ask you to put in a zip code, and then it will ask you if you get help with any of these costs. We're going to put I don't get help from any of these programs. Let's put in the same prescription drugs that we put before. You'll add that, keep the brand, and let's add another drug. This time we will do the generic that we did before. Also, it's important to remember to select the correct dosage. We are done adding drugs. Again, we're going to select pharmacies. We'll pick a mail order, Walgreens, Harris Teeter. What else can we pick? Let's do CVS. And let's pick something a little less popular. We'll try that one as well. Done. All right, so here are the 21 plans available to us. Again, it's sorting by lowest drug and premium cost. Now you could, if you wanted to, just sort by lowest premium. And here you go. There's actually a plan that's $0 per month, and we are seeing this with the WellCare plans. However, based on Medicare.gov's calculations, we would better be served going with a different plan based on our estimated yearly costs. So let's take a look. We have the Silver Script plan, which has a $5.20 monthly premium. And here are our estimated costs at a retail pharmacy and a mail order pharmacy with this plan. It looks like it's going to be the same, $468.48. And the deductible is $280. So let's add this plan to compare. Now let's go back up. And this time, let's sort just by lowest monthly premium. So again, this is taking us back to that WellCare plan. We're going to add that one to compare. And I'd also like to take a look at the lowest drug deductible. This one has a $0 deductible. So let's add that plan to compare. So here are the three plans that we chose. We have a $5.20 monthly premium, a $0 monthly premium, and a $78.90 monthly premium. There is, generally speaking, a very strong relationship between premium and deductible. Usually the higher the premium, the lower the deductible. And we see that here as well. We have a $0 monthly premium and a much higher deductible. And now we'll just compare the pharmacies and costs. Scrolling down, you can see that all of these pharmacies are covered except for Walgreens, and for the other plans, they're all covered. And here's an estimate of our costs. So let's take a look. We see that CVS would be $470, Walgreens out of network, so we don't want to do that, $468, $473, and $468. So all pretty comparable. Here we have $542, $550, $550, $528, and the lowest cost for this one is the mail order pharmacy, $496. Coincidentally, this is also the lowest cost, but it's tied with Harris Teeter. And then on this much more expensive plan, we have much more expensive copays. So looking at these alone, it's pretty clear that this would not be the plan for you based on that information. You can also click here where it says Plan Details. And if you scroll down in here, it'll break down your yearly drug costs by pharmacy. So it's possible that in one pharmacy, one prescription might be less expensive than the other. Now, our generic is $0 or $480. So it's $0 at CVS, $0 at Harris Teeter, $480 at Hawthorne Drugs, and it's $0 at the mail-in pharmacy. Now, that being said, take a look here. Even though the generic is $0 here, the name brand is $408. This is your yearly cost, of course, and it's $406 at Hawthorne. So let's be real, it's only a $2 difference, but it could be a more significant difference. So going on this alone, it would be better for you to get your generic filled at CVS or Harris Teeter or the mail order pharmacy and have your Synthroid filled at Hawthorne Drugs. Again, it's only a $2 difference, but it could be much more significant, in which case it would be helpful to know this. And then down here, we'll break it up even further based on the month. Now, if you're seeing here that all of a sudden your costs are dropping from $44 to $29, that's because you've met your deductible. So at that point, the Synthroid, which is your name brand, would be a lower copay instead. And that's why all of a sudden we're seeing $29, $22 instead of that higher $44. If you were to continue to spend, which won't happen based on this case example, eventually you would hit the donut hole or coverage gap and you would see those costs jump back up. Remember that the AEP is from October 15th to December 7th, and there can be a late enrollment penalty for Part D, so make sure you enroll on time. So do you have any questions about Part D? Have you found a plan that's worked for you in years past and this year you're just overwhelmed with the choices? Let us know in the comments below. We'd love to hear from you. As always, have a wonderful day. Bye-bye. Before you leave, if you want to learn more about the costs in each of those stages of Medicare Part D and the dreaded donut hole, make sure to check out this video. Oh, and please make sure to subscribe and like this video as well. We'll see you next time.